Is Medicare Advantage good or bad? You have probably seen the debate all over the news, social media, and even in Congress. Some people swear by it, others say it is a trap. The truth, as with most things in Medicare, is more nuanced than either side admits. Today, I am going to give you the most honest, balanced breakdown of Medicare Advantage you will find anywhere. The real pros, the real cons, the 2026 changes you need to know, and exactly when it makes sense and when it does not. No sales pitch, just the truth. My name is Antonio Espino, founder of Espino Insurance Group. I'm a licensed Medicare insurance agent serving families across the entire state of Texas, including right here in the Rio Grande Valley. I work with both Medicare Advantage and Medicare Supplement clients every single day. I do not have a preference. My job is to find the right fit for each individual person. And that objectivity is exactly what I am bringing to this conversation today. First, a quick refresher. Medicare Advantage, also called Medicare Part C, is a type of health insurance plan offered by private insurance companies approved by Medicare. These plans combine your Part A hospital coverage, Part B medical coverage, and usually Part D prescription drug coverage all in one plan. They are required to cover everything original Medicare covers, but they can also add extra benefits like dental, vision, hearing, and fitness programs. In 2026, more than 33 million Americans are enrolled in Medicare Advantage. That is 54% of all Medicare beneficiaries. It is now the majority choice, so clearly it is working for a lot of people, but it is not for everyone. Let us start with the real advantages because they are significant. Number one, the cost. Many Medicare Advantage plans have $0 monthly premiums beyond your Part B payment of $202.90. For someone on a fixed income, that is a meaningful difference. Number two, the extra benefits. Original Medicare does not cover routine dental, vision, or hearing. Many Medicare Advantage plans include all three plus fitness memberships and transportation to appointments. Number three, the out of pocket cap. Original Medicare has no out of pocket maximum, meaning a catastrophic illness could cost you unlimited amounts. Medicare Advantage caps your annual exposure. In 2026, the maximum cap is $8,850 for in network services. Number four, prescription drug coverage included. Most Medicare Advantage plans include Part D drug coverage, and in 2026, your drug costs are capped at $2,100. And number five, 95% of Medicare Advantage enrollees report being satisfied with their care. That is a remarkably high satisfaction rate. So, who is Medicare Advantage the best fit for? Generally speaking, Medicare Advantage tends to work brilliantly for people who are relatively healthy and do not use a lot of medical services, whose preferred doctors are in the plan's network, who take mostly generic medications, who want extra benefits like dental and vision without paying extra, who want to minimize their monthly premium costs, and who live in an area with a strong Medicare Advantage network. If this describes you, Medicare Advantage could be an excellent and cost effective choice. Now, let us talk about the real limitations because they are also significant and you deserve to know them. Limitation number one, network restrictions. Unlike original Medicare, where you can see any doctor in the country who accepts Medicare, Medicare Advantage plans restrict you to a network. If your preferred doctor is not in the network, you either pay significantly more or find a new doctor. Limitation number two, prior authorization. This is the most common complaint about Medicare Advantage, and it is a legitimate concern. Medicare Advantage plans can require pre approval for procedures, specialist visits, imaging tests, and certain medications. According to the Kaiser Family Foundation, over 2 million prior authorization requests were denied in recent years, and 13% of those denials were for services that would have been approved under original Medicare. Limitation number three, plans change every year. Benefits, copays, networks, and drug formularies all reset on January 1st. A plan that worked perfectly this year could look very different next year. In 2026, nearly 3 million Medicare Advantage enrollees had to find alternative coverage after their plans reduced service areas or exited markets entirely. I want to spend a moment on prior authorization because it is the most debated issue in Medicare Advantage right now. And there have been important changes in 2026 you need to know about. Prior authorization means your plan must approve certain procedures before you receive them. Your doctor recommends an MRI. Your plan says, wait, we need to approve that first. That approval process can take days or even weeks. For someone in pain or managing a serious condition, that delay can feel agonizing. Now, here's the good news. In 2026, CMS, the Centers for Medicare and Medicaid Services, finalized a new rule that Medicare Advantage plans must honor their prior authorization approvals for inpatient hospital admissions. They cannot reverse an approval after the fact without evidence of obvious error or fraud. And Congress is actively debating further prior authorization reform through the Improving Seniors Timely Access to Care Act, which has bipartisan support from over 248 House members and 64 senators. So the system is being improved, but prior authorization remains a real consideration when choosing a Medicare Advantage plan. Now I want to share what many experts call the Medicare Advantage trap because this is the most important thing you need to understand before enrolling. When you first become eligible for Medicare at 65, or when you first get Part B, you have a guaranteed right to purchase any Medicare supplement plan without medical underwriting. That means the insurance company cannot deny you or charge you more based on your health. But if you enroll in Medicare Advantage first and later decide you want to switch to a Medicare supplement plan, you may face medical underwriting in most states, meaning the insurance company can deny you coverage or charge significantly higher premiums based on your health conditions. So, if you choose Medicare Advantage and then develop a serious health condition, switching to a Medicare supplement later could be difficult or impossible at a standard rate. This is why the decision you make at 65 matters so much and why I always recommend people fully understand both options before enrolling in anything. So, when does Medicare Advantage not work well? Medicare Advantage tends to be the wrong fit for people who see multiple specialists regularly, who have chronic conditions requiring frequent and complex medical care, whose preferred doctors or hospital are not in the plan's network, who take expensive specialty medications, who travel frequently and need nationwide provider access, and who want the freedom to see any doctor in the country without restrictions. For these people, original Medicare with a Medicare supplement plan may provide better access to care and more predictable costs, even with a higher monthly premium. Before I wrap up, here are the most important Medicare Advantage changes for 2026 that affect your decision. First, more than 7 million Medicare Advantage enrollees lost extra benefits in 2026 after a major pilot program called the Value Based Insurance Design Model was terminated because of excessive costs. This means some plans that offer generous food cards, transportation, and other extras in 2025 no longer offer them in 2026. Second, the out of pocket maximum for 2026 is $8,850 for in network services. Make sure you know your plan specific limit. Third, the Part D drug cost cap is $2,100 in 2026, protecting you from catastrophic drug costs. And fourth, some major insurers reduced their service areas in 2026. So if you are already on Medicare Advantage, verify your plan is still available and your doctors are still in network. So how do you know which is right for you, Medicare Advantage or original Medicare with the supplement? Here is my honest framework. Ask yourself these four questions. 1. Are my preferred doctors in the Medicare Advantage network in my area? 2. Do I take any expensive specialty medications that might be better covered under a different plan? 3. Am I generally healthy or do I have chronic conditions that require frequent specialist care? 4. Do I value lower monthly costs and extra benefits more than I value the freedom to see any doctor anywhere? Your answers to these four questions will point you clearly in one direction. And if you are not sure how to answer them, that is exactly what I am here for. Whether you are here in the Rio Grande Valley, in Brownsville, Harlingen, or McAllen, or anywhere across Texas, in Houston, Dallas, San Antonio, Austin, or El Paso, I can sit down with you virtually or by phone and help you answer every single one of these questions. I work with Medicare Advantage and Medicare Supplement clients all across Texas every single day. I do not push one over the other, I find what fits you. If you want a completely honest, no pressure review of whether Medicare Advantage is right for your specific situation, call or text me directly at 956 455 1313. Again, that is 956 455 1313. Or click the link below to schedule your free Medicare review. I will look at your doctors, your medications, your budget, and your health situation and give you my honest recommendation. No sales pitch, no pressure, just honest guidance. And if this video was helpful, please subscribe to the channel and hit the bell so you never miss a Medicare tip. I post new videos every week in English and in Spanish designed specifically for Texas families. Share this video with someone who's debating Medicare Advantage. This could help them make the right decision. In the next video, I am going to show you exactly what happens if you miss your Medicare enrollment deadline and the lifetime penalty you could face. I am Antonio Espino with Espino Insurance Group, and I will see you in the next video.